Hey guys, good morning. It is Thursday morning. I hope some of you were able to join me last night in the Christmas Carol Telethon. If not, you can still catch it on my Facebook page and subscribe to the Instagram and my YouTube channel. So today I have you with my rock star, Chris, and he's going to be my little model for this morning. We talked a lot about phantom pain and phantom sensation and what can be done. We did a show on that at the beginning of this month, and we talked a lot about conservative management by doing mirror box therapy. Okay, so today I don't have an actual mirror box, but I do have a mirror, so I just kind of wanted to demonstrate how that can work for you and how you can start doing this technique at home. All right, so here I was actually in the back of my clinic in the supply closet, and I found an extra mirror just by chance. And as you can see, it's nothing fancy. It's just one of those back of the door mirrors that you can find at Home Depot or Walmart. It costs less than $20 to grab a mirror like this. So hopefully you guys can see Chris is a left above the knee amputee. So his residual limb is over on that side and his sound limb is over here. So we're gonna put the mirror in between and he's gonna fix it so it's comfortable. Now this is the first time that Chris did this, and when I put the mirror on him a few minutes ago, his eyes got this big. So it's a really interesting.
This is amazing.
It's a really interesting sensation. So for those of you who've never tried this since your amputation surgery, it's a really amazing experience to see both limbs again. And sometimes just the process of seeing both the limbs without doing anything can be enough to help ease some of that phantom pain or phantom sensation that you're feeling. Excuse me, I'm having a hard time talking with this. So when you're doing this, usually I just have people start off like this, just having them look inside the mirror and just have a look at their feet, have a look all the way up and down their leg, and just see if it affects their phantom pain in any way, okay? Now, once they kind of get used to seeing themselves in the mirror like that, then we'll start with something very simple, just as simple as wiggling the toes. So Chris, go ahead and wiggle. Okay. And at the time that he's wiggling his toes, he's looking in the reflection. Hopefully you guys can see that. He's looking in the reflection to see the reflected foot also wiggling. Okay. And then as that gets a little more comfortable, we'll have more of the ankle movement, which he's been doing already, pumping the ankle up and down. Okay, and again, the whole time he's looking at this side. He's not looking at the residual limb, okay? And then as he gets more comfortable, he can go ahead and start slowly bending his knee. Go ahead and bend your knee up slowly, and then straightening it out. Can you guys see this okay? Can somebody give me a thumbs up if you can see what he's doing? Slowly up, and then slowly down. Now, if there's a particular spot, like right now, Chris, do you have any phantom pain? Are you feeling anything right now?
No.
So at the moment, he's not feeling anything. Thanks, guys, for the thumbs up. So during the time that you're experiencing that pain or itching, that's another one that really bothers a lot of folks that I know, that they have a particular itch that they can't scratch, right?
All the time.
So there's a couple of things that you can do. You can either look at the reflection and scratch the reflection. Not kidding, this has worked for some people. Scratch the reflection in the place where you feel like you have the itch, or if you're feeling the itch on your phantom ankle, for example, give it a scratch on your real ankle, on the ankle that's still there, and sometimes that will also help bring some relief, okay? Now here's the thing about mirror box, and we discussed this a little bit in the show at the beginning of December. It doesn't work for everybody, okay? And some people will say it doesn't work. Some people will tell me, well, it worked when I had the mirror on, but the minute I took the mirror off, the pain came back. So here's my response to that, guys. Using a mirror box therapy, you're not having to use narcotics. You're not having to inject anything into yourself. This will not hurt you, so why not try it? And it's a very inexpensive strategy to try, okay? And the other thing, for the folks who say that they feel relief when the mirror is on, but then when they take the mirror away, that's when the pain comes back. My answer to that is consistency, okay? And even if you can just get relief for a few minutes, I know I've had some people tell me if I could just have relief for a few minutes, it would be well worth it, and I completely agree. But it's also about consistency. So it doesn't take very long, but if you can just do this for a few minutes every day and just make a habit of it, that's when you start to see some of the more long-term relief and results from it, okay? So guys, I want to know what you think. And again, very inexpensive, less than 20 bucks at Walmart or Home Depot to grab a mirror and to practice this. So we're going to get back to work with Chris, and thank you, Chris, again for being a wonderful patient model for me this morning. Guys, let me know what you think. Have you tried mirror box therapy before? If not, give it a try and tell me how it goes for you. All right, guys, have a great day, and we will see you next time.